Good afternoon. A very warm welcome to you on Parentune Live. I hope you and your family are doing well. My name is Jharna Kukreja and I am your host for today. Today I am joined by Parentune expert Dr. Vitika Kapoor to answer all your questions on how to tackle speech and hearing issues in your child. Dr. Vitika, to start off with, what are speech and hearing issues in children interlinked in any way? And if so, how are they interlinked?
Good afternoon, everyone, and welcome to the live session of Parentune. Thank you, Jarna. And okay, so the question which you have asked, the if there is any relation between speech and hearing, and
That's
yes,
right.
there is. So there is a not only I would say there is a relation. It's like it is completely interlinked because whatever we hear, that is exactly how we speak. Uh, so you have started speaking a specific language because you started listening to that language from very beginning, from the very first day of your life, and that's how you learned that particular language. Now suppose if there is a child who has got some hearing problem, and whenever you speak to him, he only sees. This does not have any meaning. So obviously the child who is exposed to this just visual form of language, he's not going to achieve language at all. Auditory language will not be there. There'll be no spoken language. So this is completely interrelated. Now consider a situation wherein child has some partial hearing loss, wherein there is some sounds reaching, but sounds maybe are distorted in between or not heard properly. This particular child will have language, but will exactly speak the way he hears, so the sounds will not be clear, the language might not be complete. So these are the kind of things which we will see in this particular child. These are the kids who become really difficult to identify because most of the loud sounds they would respond to, they have already started gaining language, not up to the mark, and still there is a lack. The clarity which at times we take that the child is young, so that's why the clarity is affected. So these are the tricky kids, and these are the kids who needs to be identified early so that their development takes in a proper pace. So that this is exactly what I would say to this question, Jharna. I hope this clarifies.
Thank you, Doctor. If you've just joined this Parentune Live, we are answering all your questions on how to tackle speech and hearing issues in your child. We are with Parentune expert and speech therapist and audiologist Dr. Vitika Kapoor. Dr. Vitika Kapoor is the founder and director of We Listen Speech and Hearing Clinic in Gurgaon. She is a senior speech and hearing consultant with over 14 years of experience, and her expertise is in pediatric audiology and speech therapy. If you think your child is not developing speech at an expected rate or is facing any hearing trouble, you can share your questions or comments in the comments section and we will have them answered by Dr. Vitika in just a short while. You can post your questions in either English or Hindi. Dr. Vitika, as a parent, how would I know if my child has a hearing problem? What are some of the signs or symptoms I should look out for?
Okay, so Jharna, first of all, the early symptoms of hearing problem would be that the child will have delay in speech and language development. The pace at which the child should be starting to speak is always delay when there is a hearing problem. The other markers would be like unclear speech or language is there, but it is not age appropriate. The third more important signal would be that whenever you are visible to the child gives complete attention. But if you are at the back and then you are trying to speak to the child, most of the time the child remains inattentive, or there are inconsistent responses to sounds. Like at times you feel that there was a response and child suddenly turned back to whatever you said, and at times you most of the time you feel that maybe the child was engaged with the play or the toy which he was playing, and most of the time you have these kind of thoughts in your mind. You are clarifying your own negative thoughts. I would say these are the situations which works as an alarm, because it is important, it is a hidden handicap, and at times if you don't notice it early, it creates a long term impact on child's life. So it is important to identify it early. So these are the early signs which you would see in a child with hearing problem. Also, there are acquired hearing problems also. So like, there are very frequently we see kids who have got cold, and due to cold and cough they have got hearing issues. So in these kind of kids, this you should start noticing some, apart from the hearing issues, you would also start noticing, like, the child is rubbing his ear a lot, or maybe, a little cranky for few days, and having some started having fever also. So these are certain symbols or signals which would indicate that the child might have some hearing issue, or something wrong with the ears.
Right, Dr. Vitika. Our first question today from a parent comes in from Bangalore, from Sejal Khanna. Sejal says, my son, who is 5 months old, doesn't react to loud sounds while sleeping. He also doesn't look in the direction of sound sometimes. Though he has passed the auditory test at birth, but I'm still confused as he doesn't respond to his name and also doesn't make any sounds. Is this a cause for worry? So, doctor, are these some of the signs that there could be a possible hearing issue?
Okay, so thank you, Sejal, for your question, and I'm really happy that you are an aware parent. So now, in this case, particularly, if I talk about, see, there is something called hearing, and there's something called listening skill. A newborn baby, does not have that good listening skills. So though they are able to listen to the soft sounds, also they don't know how to react on those sounds, and they most of the time they ignore those sounds. So I would say a child who is around 6 months should be reacting to a sound which is somewhere around 60 dB. So like a loud rattle, if you are playing within maybe 1 to 2 feet, that should grab an attention of the child. If that is not happening while he is awake, if that is not happening, that is a point of concern. Second thing, you said that you mentioned that your child does not respond to very loud sound even when while he is sleeping. So at times when the child is deep sleep, they don't react to even louder sounds also. It'll be good to see when the child is about to sleep, he's drifting into sleep, is in light sleep, and that time if you make a sudden loud sound which is not exactly in the premises of where the child is sitting, so that there is no vibration which is felt, and you are presenting it somewhere out, like suppose for an example, if a child is sitting or lying on the bed, you bang the door and see if that gives a startle from the child, because at this particular stage the loud sound should give us a startle. If there is no startle, then there is a point of concern. Then I would say that there is something which we need to look for. So this is second. Third, you mentioned about not turning towards the sound. This is what we call as localization. So localization skills usually develop by 6 months to 8 months of age. By this time at least you would start seeing when you talk and move, the child should follow with visual, not by head, because it's localization requires your neck muscles also to be strengthened enough. So if there is no neck control for any reason, if the child is not able to hold his neck properly, this particular thing also would be affected, but that doesn't mean that the child has a hearing problem. So localization can also be seen with eye movements. So eye movements, if a sound source is moved from left to right, the child would move his eyes. So this is the kind of localization which should start happening at this particular age, and if the child has good neck control, then in fact even turning towards the source would also happen by 6 to 8 months. So this is something which you should look for. And I would say, if he's just 5 months, I would say just wait for 1 to 2 months and try to understand where your child lies in whatever I have explained. If he has good neck control, try to elicit that particular response. If there is no response, then maybe it is something which is important, because most of the time the screenings which are done at the time of birth is OE, and OAE has, though its specificity and the reliability of this test is high, but it does give false negative responses at times. So if your observation is not matching with the responses which we get on OE, then it'll be good idea to consult a audiologist. This is what I would say.
Dr. Vitika, you mentioned to Sejal, in fact, Sejal mentioned in her question that her baby had passed the
Yes.
test hearing test at birth. So, how important are these hearing screenings, and at what frequency? She mentioned her baby was 5 months old, and post birth, he has not had a hearing test. So, at what age should a parent have a hearing screening done for their child, and how important are these hearing screenings?
Okay, so very important question, Jharna. So it is mandatory. It is made mandatory now that all the kids before they are discharged from the hospital. This is something which is ideal. If it is not followed, at least within their first month of their life, by the time they turn 1 month old, they should have their hearing screening done. And most of the hearing screenings which are done in India are done with, there's a test called OAE, autoacoustic emission test. This is the test which is very commonly used for hearing screening, and this is exactly what I said, that this has a specificity and reliability ratio which is quite high. But at times there are false negatives and false positives coming in this particular case, and that is the reason why we specifically ask parents to observe, to make observation, and get back to us whenever they feel alarmed. So this is for from at the time of birth that the universal screening should happen. Then once the child has started developing everything, the speech milestones are also coming in a proper place, and there is no reason of any concern in terms of the hearing, then the regular screening should be done for middle ear disorders, because the second largest thing which is coming in when you talk about hearing issues in kids is middle ear infections. And if I give you the data on this, 50% kids by the age of 5 years, they at least once have some kind of middle ear issue or middle ear infection, which can actually an issue, and which is actually a cause of concern. So this is something which needs to be identified, and the kids are too young, they cannot understand that they have pain in their ear. Even if they understand, they don't know how to communicate it to parents. The feeling of fullness, the feeling of heaviness, the feeling of discomfort, that is something which they cannot explain. So it is a good idea to get the child screened for middle ear disorder, and for that particular thing we suggest impedance test. Impedance test needs to be done at least once in a year, and till the age of 5 years. Why we say 5 till 5 years? Because by 5 years of age, the child is grown up enough, has enough of language to communicate if he faces any specific issue in terms of their hearing or ears as such. So this is the reason why OE at the time of birth, which is a part of universal hearing screening, once that part is clear, then completely going ahead with middle ear screenings, which is every year once till age of 5 years. This is what I would recommend.
Right, Dr. Vitika, you mentioned that middle ear infections are one of the main causes of hearing issues in children. So, what are some of the other causes? Are there other causes, first of all, and what are some of these?
Yes, sure. So, for this particular, to answer this particular question, Charna, I would go ahead with some of the data. So, when a child is born, if I give you the data of Indian scenario, 4 infants out of 1,000 birth are born with hearing loss, which is most of the time a profound hearing loss. These are the kids who are born with profound deafness, and if not treated, they are going to be completely mute. They are not going to speak. This is the data at the time of birth. Now this data, like 1,004, increases, the number significantly increases if I talk about by 15 years of age. 15% of kids have some or other kind of acquired hearing loss. So the number has changed dramatically. If you say, see, 4 in 1,000 and now 15 in 100. So there are certain reasons due to which the acquired hearing loss comes in. The major which we discussed was middle ear infection or cold and cough, which frequent cold and cough, which impacts hearing. Apart from that, there could be hearing losses because of certain kind of viral infections, which also leaves permanent damage to hearing, and it can be right from mild to moderate, very minimal loss to high degree of hearing loss, which can also occur. Meningitis is in fact one of the condition. If there is meningitis, and if you know that your child has undergone meningitis, it is important to assess their hearing immediately, because in this particular case, the hearing loss is of that type that it cannot even be treated with the best of the technology if it is not immediately seen. So meningitis is one of the condition. Measles, this also, gives us hearing problem, which is a permanent damage. Chicken pox, there are certain genetic causes which actually gives a gradual onset hearing problem, which shows somewhere between 4 to 5 years of age. And these kids typically would develop language, but at after a point of time they would stop gaining any more concepts of language. It would be like just a basic language which they would start speaking, and there would be a deterioration in that language and clarity also which can come in. So this is something which can come as an acquired hearing loss cases. Very common apart from all this could be just vex. So most of the time we feel that, if we are using an earbud and we are cleaning the ear of a child, we feel that the ear looks clean from outside, and it is it is okay and it is clean. But most of the time whenever you clean your ear with earbud, the wax is further pushed towards the tympanic membrane. So from outside it remains clear, but actually it goes in, and it gets accumulated over the tympanic membrane, and that gives a rise of a hearing loss somewhere around 40 dB, which is quite a high degree of hearing loss. So this also comes in picture, which is quite common. So these are certain causes which can create hearing issues in a child.
Right, Dr. Vitika, you mentioned that wax could be an issue for a child's hearing loss. So, how does one treat an issue of wax in their child's ear? And because you mentioned using a bud would further aggravate the problem. And, so how to treat this particular issue, and what are the other modes of treatment when it comes to hearing issues?
Okay, Jana. So first of all, our ears are made in such a way, god has created us in such a way that the wax automatically comes out, and it is, it is the three outer part of the canal wherein the wax or cerumen is made, and it has a specific purpose. The purpose of cerumen or the wax, which we call, is basically to prevent any insect or anything to enter in your ear canal, so that it sticks there, and it is exactly there, it is stopped, it does not enter further into deep into your ear canal, to avoid any discomfort which can happen because of this. So this is why, this is the purpose of having that serum around the outer ear canal, the canal which we can see from here, from outside. So the wax automatically comes towards outside. So when you see anything coming outside, that means you should be assured that your ear is functioning well. You just need to clean it off with a wet towel, just wet towel dried completely, and just wipe it off the till the till the place where you can keep or take your finger in is exactly good enough to clean your ear. That is exactly what you should be doing. So it is automatically getting clean. If you further try to clean it by using a earbud, you are actually not cleaning but inserting the wax further in. So nothing is to be done. Ideally it is happening automatically. Just wipe it off. That is exactly what I would say. So when you are taking bath, just take a cotton damp cloth and just clean it. That is exactly what I would say in terms of managing your cleanliness of ear. That is it. Now coming on to modes of treatments for hearing issues in children. So as I said, I am going to take back you to the data which I quoted, that there are around 4 kids in 1,000 birth who are diagnosed with profound deafness and who are born with hearing problems. So and by the time they are around 15 years of age, it goes 15% in that means 15 out of 100. So now depending on what kind of hearing loss the child has, like if I talk about middle ear issues, if I talk about vex, these are the certain conditions wherein hearing loss can completely be treated with medicines, or if it has been in a prolonged for a prolonged duration, then maybe a surgery is required. But these are completely treatable and reversible hearing problems, and that can be worked upon. Now, if there is a permanent damage to ear, and if there is some degree of hearing loss which has come permanently, now in this case, uh, we have to provide a solution to the child, and then in that case we might have to fit in a hearing aid. So hearing aid is a device which helps the child to listen better the soft sounds, the sounds which the child is not able to hear. So please notice this particular statement here. When I make this statement, I'm saying that the child is able to hear louder sounds, but the softer sounds are missed, and that's the reason the child has incomplete language, or is not able to acquire good language, or is not able to cope up with the environment where he is in. So now in this case, hearing aid would just amplify, and the residual hearing, the amount of hearing which is still left in his ear, is going to help him, overcome this problem with the hearing aids on. So hearing aid is another solution which is given to the child who has got permanent hearing problem, and it is very common right now nowadays. And third is, like, the for the kids like who are born deaf, who have got profound hearing loss, the hearing loss which is like of this degree that they can only hear maybe a loud door bang, or they can only hear a sound of a crackle, or a airplane going by. So these are the kids who require, most of the time they require cochlear implantation. So this is an implantable solution, wherein these are the cases where hearing aids, wearing a hearing aids will not help much, because they don't have anything left in terms of hearing in their ears. So in these cases, we work upon cochlear implantation, and with assurance, I can say that those who are implanted and at right age, the ideal age of implantation would be 1 year. So they should be identified by 6 months of age, should be worked upon for their rehabilitation in the sense, further preparing the child for implantation, and then implantation should happen by 1 year of age. This is what is preferred. If that happens, this child remains completely normal in terms of every aspect of their development. They remain completely normal. Just one fact that they are wearing something outside, otherwise they are completely normal. They can go to normal school, they develop normal language, they have good social and interpersonal skills, they get good vocational benefits, and everything is possible for them. Fine. So my why I'm giving a lot of emphasis here is, there is an implant, there is a solution which is available for these kind of kids, and if it is done on right time, it can give us very good results. Fine. So awareness is the key here. So we need to know that there is something like this available.
Right. Dr. Vitika, you also mentioned an alarming statistic of the fact that when children are born, the percentage of babies with hearing issues is 4%, but the progression till the age of 15, it increases up to 15%. So, with an increase in so many hearing issues, are any of these issues preventable? And if so, how? How can you, as a parent, help your child, prevent any hearing issues in your child?
So, Jharna, I have already answered this question, but I'm just putting it in a different words now. So,
Okay.
as I said that certain causes of hearing loss are preventable, wherein there is either so there are two ways of preventing. One is primary prevention. So, primary prevention, before the thing has occurred, we have stopped it from coming. So, this is exactly what we are trying to do when we are doing our middle year, as analysis every year once till the age of 5 years. So if there is any sign, initial sign, which shows that there is some impact of cold and cough into your ear, before any other further damage comes, we are already aware of it, and we know, we have seen the doctor and took the medicine, and it is over. This is the one way of prevention. Then secondary prevention is like, when this is already come, you have certain signs which the child has already started showing. Maybe the child has started having fever, child is rubbing his ears a lot, he has already have some degree of hearing loss which is already there, because it was a cold cough which has entered into the ear. It was a sustained frequent cold cough which was there with the child, and it has infected the middle ear also. Now in this case, maybe a surgery, maybe little longer treatment, medical line of treatment is required, and then again it is kind of treated, and the child gets back to the complete normal level of hearing what he had earlier. So this is also possible. This is a secondary level of prevention. I would say it's better to tackle it first. So it's like primary prevention which becomes more important. So Tackle it before it has come. Be little aware of the small signs and symbols. Be regular to your screenings, and we are sorted. That is exactly what I would say. And again, cleaning of your ears. So wax, if you know how to clean wax ideally, you would not get into that kind of situation.
Right, Dr. Vitika. Doctor, our next question comes in from Neelu, who says, hello, doctor. My son is 3 years, 2 months old, and he speaks alphabets, numbers, counting, and recognizes shapes and says rhymes. But he doesn't speak by himself in sentences. Few words he says, which he knows, like hand wash. And if you ask a question, he will repeat the same question. Please tell me if there is any problem.
Okay. Thank you, Neelu, for your question, first of all. And you said that your son is 3 years. He can he can count numbers. He knows different shapes. He knows the name of different objects. You said that he can repeat certain, whatever you say, he repeats those kind of things. So it looks like that the child is not able to understand the concept of language as such. There is not much of comprehension which is happening here. What I can see majorly here is that the child has good imitation skills. He So this usually happens when the child does not understand much, and he is listening something, and he knows that whenever there's someone talking to me, I need to answer something. So in this particular case, what child starts doing is whatever is heard would repeat exactly the same thing. So majorly the area which is affected here looks like to me is comprehension, understanding. So you need to work upon understanding of language specifically, first of all with him. Also, what is the kind of play behavior the child has is important for me to understand here, because I the kind of situations which you are giving me leads towards a specific kind of representation. And I would say it'll be ideal if you get connected to a professional, because he requires an assessment. We need to understand why it is happening that way. Why it is difficult for the child to comprehend the language in a meaningful way, so which is lacking here. And along with meaningful language, if there is a lack in terms of social development, social interaction, and age appropriate play behavior, then I would say it is a cause of concern. And I would recommend that a professional help is needed. You need to consult a professional.
Right. Our next question comes in from Soumya Ajmani. Soumya says, my nephew, who is 2 years, 9 months old, is in the Gulf since he was 3 months old. Up until his first birthday, he was doing perfectly well. But after 2 years, also, he has not started talking. Till now, he won't communicate with us and is also very hyperactive. Some say here that children start talking late, whereas some friends have pointed out that it could be a speech delay or ADHD. What should we do? Do you have any advice for Soumya regarding her nephew?
Okay, thank you, Soumya. And yes, your friends are right. This is a need of this is a point of concern here. 2 year, 7 month old child should be speaking meaningfully, should have a vocabulary of somewhere around 100 to 200 words, which is quite a high number. And yes, the kind of restlessness, though, at this age, kids are little, they are like this, that don't sit at a place, but they give attention, they pay attention to something which they like, or people in their surroundings, they like to attend to them, even if it is like for a brief moment of period, but they would like to attend to them. So if it is something which is lacking, then definitely it is a point of concern. And I would say it would be important that we you get connected to a professional and get him assessed for why there is a lag which is happening, because this kind of representation happens in many these are the symptoms of certain similar group of disorders. So we need to understand where exactly does he lie, and based on that, the answers or the treatment would be available to the kid. So I would say it is important to consult a professional. Definitely you should go ahead.
Right, Dr. Vitika. In the case of Soumya's nephew, we've seen that even after the age of 2, he's not able to communicate effectively. So, what are some of the speech milestones that you as a parent should be looking out for when it comes to, your child's communication skills and speech?
Yes. So, Jhana, this is one of my favorite question, and I keep answering this question quite often. So, first of all, a child who is around 3 months will have a lot of pleasure sounds. Will be like a lot of gurgles and cooing kind of a sound, which is there at that at age of 3 months. At age of 6 to 8 months, child starts repeating. Repetitive movement and repetitive sounds are quite common in this particular stage, like mama, 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 ba, 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 ba. These kind of, or most of the sounds which are labial sounds, like those sounds which are produced by lips. So these are the sounds which are very common at around 6 months of age. By 6 to 8 months, the child starts comprehending that they have a name and they respond to their name. And whenever you call them by name, they would turn or would show some reaction. Fine. So they start identifying their by a name by 6 to 8 months of age. When you talk about between 12 months, somewhere around 12 months, they already have a first word. They acquire their first expressive vocabulary, expressive word. That means the word which they can say. Most of the time it is mama or papa. These are the words which they start speaking. This comes by first year of age, and at this age when they speak one word, they are able to comprehend more, somewhere around 10 to 20 words. So 10 to 20 words like bye bye, mama, where's mama. So what they are doing when you say where is mama, the child is only understanding one word, that is mama, and because of this particular word the child would locate. So it's not where, which is the child is able to understand. So understand this particular part, that they have comprehension, understanding of around 10 to 20 words. They are expressing just one word at that particular time. Then by age of 2 years, the child would start having vocabulary of somewhere around 100 to 200 words. This is an expressive vocabulary. They can speak that many words. So you can see the leap of growth which comes between 1 year and 2 years. So most of the time when we if you divided these do two age groups into stages, you would see that till for 1 year it is more of an observant stage. From 2 years it comes the stage of talkative child. So you will see that the child would develop a lot of will gain a lot of growth in terms of their spoken language. So this is exactly start happening at around 2 years of age, when they have 100 to 200 words as a vocabulary. They can join two words together. The first milestone in terms of their proper language, which comes around 3 years of age, when they start using a simple sentence. That is the first place wherein they have started putting in a correct grammatical structure, and they would use proper grammatical structure to form a complete sentence. Though the sentence would be just just having 3 to 4 words, but it would be a complete sentence. This comes by 3 years of age. Any child who is lacking from all these developmental milestones, or having a delay in that, is a child who needs to be seen why that delay is coming. Because when I talk about these delays, let me just explain it to you. These delays are just like fever. Fever can come from for any reason. Fine. It based on what reason the fever is coming with, we treat the particular problem. Now in this particular case, if there is a delay, for what reason this delay is coming is important for us. This reason could be a very simple reason, that maybe the child is exposed to too many languages and he is getting confused, that's why he's not able to understand. Or something internally, something which is which is affecting child's attention, or child is not able to pay attention. Or something like hearing problem, that the child, though he's surrounded with people, but he is not able to hear them out, and that's the reason there is a delay. So it could be anything, but you need to understand, if there is a delay, it becomes important to identify that delay and it related to the cause, and treat the cause immediately. That is exactly what you should start doing, and that is the reason knowing these milestones are important.
Right. Doctor, our next question comes in from Kranti S, who's writing in from Mumbai. Kranti says, hello, doctor. My son is 5 years old. While speaking to family members, he's fluent. But when it comes to strangers or in school, he starts stammering. He sings
Mhm.
also without stammering. What could be the reason behind his stammering?
Okay. Hi, Kranti. Thank you for your question, first of all. So, your son is 5 year old and he is showing stammering mostly when he is with unknown people or people whom he is not very familiar with. That is exactly what I understood from your question. So, this is how stammering comes in. So, I hope, I'm not sure whether you have seen my other videos on Parentune, which talks about what is normal non fluency. So, normal non fluency is usually a part of normal development, which comes between 3 to 4 years of age. And at that particular time, the child is not much aware about the way they speak. As they grow older, somewhere around 5 to 6 years of age, that is exactly the age when they start getting some awareness of what others are thinking about them. And that is the period, if if the normal non-fluency was not taken care of well, this is the period wherein they would start having stammering issue, which is exactly what he is also showing. And this particular issue is completely, in terms of that he is kind of he's kind of scared to of the reaction of people whom he is talking to, and that is the reason why he gets that kind of problem. So I would say it will be good to go ahead with airflow technique with him, and I think that is something a professional will be able to help you. It is a right age. Go ahead, and the treatment, once it is taken at the early stage, it will be meaningful and also would last long. The severity would not increase because he would know then that he can control this particular problem. Right now he's in his building phase of his own about the kind of concept which he's gaining in terms of his own personality. So that is actually happening right now, so it is important to treat it right away. So I would say go ahead, have take professional help. He would be taught something called airflow technique. Once that is done, he knows how to control this particular stammering, and then he would not stammer in front of anyone, because then he knows that this is something which is under his control. So this is I would recommend to you.
Thank you, doctor. We also have another question related to stammering. This time it comes in from Seema, who's writing in from Chandigarh. Seema says, hello, doctor. My son is 8 years old and he is stammering while talking. He started stammering at the age of 3. Before that, he was speaking perfectly. In fact, he also sings perfectly. Please tell me what we should do and how we can improve his speech.
Okay. So, Seema, your question is also something similar, and my answer would also be exactly this. These all are the information which you need to know. You rightly said that by around age of 3 years that the child started showing some non-fluency, and that time it was actually non-fluency. But because at times as a parent we don't know how to tackle that particular non-fluent period of a child, and we show negative reactions to the child, and these negative reactions actually creates a negative impact on child's mind, and child starts making their own image as that they are not a fluent speakers, or they don't speak fluently, they have some issue with them. This is the kind of belief which they start gaining about themselves, and this belief itself turns into anxiety, also turns into the fear of talking to strangers. And this is why they start having this stammering coming in actually. So this stammering is the root cause is somewhere else, and this is how it comes into picture. Now most of the time people say that while singing the stammering does not happen. For that I would say, see, stammering is always it always has psychological origin. So a child with stammering, mostly what would happen is, since you had started the parent had started pinpointing the child that this is what you don't speak correctly, you have not spoken this particular line correctly, why do you speak sound in a improper way. So these are the things which child starts registering in his mind. Now, whenever, even if you are not there, the child starts thinking, this particular sound I don't speak correctly. When he is talking, he sees that particular sound is coming in his next word. There is an anticipation. Fine. And because of what if I don't speak this particular sound correctly there, this is exactly what is he is loud thinking in his own mind. What happens because of all this anxiety, he actually stammers there. And what is happening? Confirmation. Yes, I stammer at this particular word or this particular statement. So there is a psychological loop which is created there. The child gets a confirmation by himself, and then comes the fear in picture. The child starts fear for initially anticipating and then getting feared of getting into these kind of situations. So this is how these things start coming in. So it's like being more and more aware of the way you speak. They become more conscious, they become more attentive to the way they speak, and more they become conscious, more and more it starts coming in. While singing it does not come, because while singing you are not conscious about the way you speak. Your entire attention is on the melody of the sound. So that's the reason, the moment your attention is drifted from your language to your tonality, you are completely fine. So answer to the situation also lies in here. So that's why I say parents not to make your child or pinpoint your child when the child has initial splutter of non fluency. If you don't give them negative reactions there, there are chances that it is just a phase which would pass by. If it is not done properly, then it would come as a stammering. And this is exactly what is seen there. When the child is singing, they won't stammer. None of a child who has got stammering would stammer while they are singing. So please go ahead. For a child who's 8-year-old, he definitely requires treatment, because he requires a professional guidance on this particular thing. And I would say go ahead with your treatment, go ahead with a speech therapist, and this should be sorted.
Thank you, doctor. I'm going to vouch for something that you mentioned. I had a child who faced a stammering issue when he was also 3 years old, and we didn't pay much heed to it or point it out, and he overcame it on his own within a few months' time. Um,
Yes.
Doctor, our next, I wanted to ask you actually, is what are some of the causes responsible for speech delays?
Okay, so Jharna, again, I mean, I have already answered this question when I was talking about milestones, but again, repeating it. So, as I mentioned there, that speech delay is a symptom. For
Right.
what reason it is coming, that is exactly what we need to find out. So, reasons can be, and there can be n number of reasons. So, it could be like starting from the anatomical reasons, like something like maybe a cleft lip or cleft palate or something which is not visible, or a tongue tie which is quite common. Apart from that, it could be the oral sensory issues which are there, like the structures are normal, but still the way the function of those structure is not that appropriate. That is something which can happen. The movements are not appropriate. This is at the level of oral musculature which we can think of. At the level of brain, it could be like if the language, the area of the brain which requires to be developed for proper language is not appropriate, or is not is not developed properly due to any reason. Most of the time these reasons are prenatal, before at the time of pregnancy. If the mother has faced some certain issues, this can lead to these kind of problems later on. A child with cerebral palsy, which is a very common situation which we see, and these kids have speech and language delay. So mental retardation, could be related to our mental ability. If there is mental retardation, then also there would be a delay. Apart from that, hearing loss, as we keep saying, talking about it, that hearing loss is one of the invisible cause, invisible hidden cause, which comes, we are not even aware of it, because otherwise child looks completely normal, behaves normal, and we don't even get to know that there is a problem. So hearing loss is one of the reason. Then there are something like the most important area which further influences the language development is how the child gets connected to their environment. Because language is a learned skill. It is it requires observation from child's side, getting complete sensory input, observing it in relation to their environment, and then getting knowledge out of it. That is exactly how language is learned. So if there is any lack of social interaction, the way the child has to attend his environment, if that is not happening for any reason, it could be like ADHD, that the child is not able to pay attention, autism, it could be anything like, there are certain sensory areas which are affected, and because of which the child is not able to pay attention or not able to attend to his environment properly. So these are the reasons which would show us language delay. Apart from that, very commonly happening nowadays is multilingual exposure. If the child is exposed to multiple languages at a time, the brain gets confused and does not know which language to pick, because every language has different set of grammatical rules. So different way, they make a statement. So if a child is exposed to multiple languages, the child would be really confused to pick up which grammatical rule to be picked up, and that is when there would be a delay. Fine. So this is another reason of speech and language delay. Third very important point, what I am continuously seeing nowadays is that we have single families, nuclear families. We don't have many people to talk to the child. Parents, are involved in their own work, and as I said, that language is a learned skill. You need to have exposure of language to be learning it. So if there is lack of exposure, that also would lead to delay in language development. This is another reason. The fourth very common reason is which is a common reason for delay in expressive language. There are these kind of cases which are very high right now, that people say that my child can comprehend and understand everything. Whatever you tell him, he'll be able to understand it, but cannot speak at all. Most of the time these kind of situation comes in when there is a lot of screenplay. Why? Because when a child is engaged with screen or a TV or mobile or a game, they are not probed in for any communication from their side. Speech is always a two-way process. It is like give and take. I tell you something, you tell me in return something. Fine, this is what speech and language communication is. But with screen, it is not happening that way. It is just a one-way stimulus which is happening. So the lack of expressive language would occur there. So this is one of the very common reason which is occurring nowadays, which has a which imposes a lot of expressive delay in kids. So these are the things which we need to be taking care of. I hope that answers.
Yes, indeed. You heard it there from Dr. Vitika about the role screen time plays in, reinforcing any delay in speech in your child. Our next question comes in from Gigi Naresh, who says, "Hello, doctor. My nephew is 7 years old. He pauses in between sentences. He doesn't stammer, but he's not able to talk fluently. He finds it hard to narrate a story or an incident. Should we be consulting a speech therapist? Please suggest."
Okay, thank you, Mr. Naresh. And 7-year-old, he is not stammering. You say that he makes sentences, and then he takes pauses, and then he continues to elaborate further.
Right.
So now, typically, if you notice in this particular child, the child has a concept of language in terms of making a complete grammatical structure, but the higher development of language has not happened for some reason. Like, let me give you an example. Uh, if I say ki, close the door, come here. Fine. I can also say the same statement in one sentence. While coming, please close the door. So this is like exactly one sentence which has actually incorporated two sentences which I made separately earlier. So this is a skill, higher language skill, wherein I learn to join two sentences together, and then creating a continuity. Then comes the paragraph. Like, once you have you have joined two sentences, then how to give it a flow so that it becomes a story kind of a thing. How it becomes a flow of incidences. So we use different words like, after that, because of this. So these are the certain markers which we use at this particular stage. If the child has some issues using these words, the child would show something what the child's showing right now. So I would say a lot of story time with this particular child would help. He has a concept of sequencing, that's why he's able to narrate a situation in simple sentences, but he does not know those markers which can be used to make it a meaningful and a connected speech. This is exactly what is missing in this case, nothing else. So there's no stammering here. See, he's taking pauses to get to remember what should be used here, what can be he be using to make it a proper meaningful communication. So he's trying to put in efforts here. So I would say start working on the areas which I have mentioned. Have a lot of story time with him. You can have a play wherein you narrate a story and then it's child's turn to narrate a story on the same story. That would help the child to overcome this particular part. Or apart from that, making the game more interesting, what you can do is take 3 or 4 objects and say, okay, both of us are going to make a story around the objects which we have created. Let's see, it's going to be a creative task. So you create another story, the child uses the same characters or same objects and then creates another story. So try and build up this kind of games around the storytelling, and that would help.
Thank you so much, Doctor. I wanted to ask you, as a parent, when you see that your child is dealing with a speech delay, how should you, as a parent, communicate with your child? Are there any techniques or strategies one should adopt while attempting to communicate with a child who has a speech delay?
Okay, yes. So, Jharna, it is one of the very relevant questions which you have asked. So, what I would say is, when you see that there's a child who is struggling to develop language, first of all, first and foremost, talk a lot to your child. First of all, start talking to your child without expecting anything in return from him. It should be like a running commentary. You start speaking, you are just completely talking about whatever you see and whatever you see your child engaged with, and you start talking about it. First of all, start doing that particular thing. Then make sure that you are making complete sentences. Don't use what we call as baby talk. So baby talk should be avoided. You should use complete sentences. However, the words which we are using should be smaller words, and should be the words which are completely relatable at that particular age. So the vocabulary has to be wisely chosen. Try to talk about things which are visibly there right in front of the child. That would also help the child understand and relate to the things in a better way. So as I said, talk a lot, speak in small sentences. This is exactly what is necessary for you. And then make everyday situation a learning experience. So see, if I am taking a help of a child who has language delay and I'm asking him, I'm making a sandwich and I make my child sit with me, and I ask and I tell him that, okay, this is a bread, let's okay, take butter and now spread butter on the bread. So knowingly or unknowingly, I'm giving him a lot of vocabulary, and this is a meaningful vocabulary. The child would understand and relate to many things at this particular time. The learning would be really really fast at this stage. Apart from, if I take some toy, we have such toys now, wherein we say it is a sandwich, it is not a relatable toy for this particular child. So fine, so this is something of which I always say, that take your day to day routine activities as a learning activity for your child, and that would give your child actual environment to learn. So do those kind of activities with your child. This is something which is going to help you a lot.
If you've just joined this Parentune Live, we are with speech therapist and audiologist Dr. Vitika Kapoor, who is answering all your questions on how to tackle speech and hearing issues in your child. If you have any questions for Dr. Vitika or any doubts you'd like to clarify, please ask them in the comments section on the Parentune app, and we will have them answered by Dr. Vitika in just a short while. You can ask your questions in either English or in Hindi. Dr. Vitika, when you're a parent and you observe that your child is facing a speech delay, whom should you consult? Should you be consulting your child's pediatrician? Should you be consulting a speech therapist? Should you be consulting a developmental pediatrician? It could be confusing for you as a parent. So, what should a parent do in such circumstances?
Okay, so Jharna, very important question. So, see, the first point of connect for any child, any parent is a pediatrician, and that is exactly where they go when they find any difficulty. And so, normal a regular pediatrician is a pediatrician who is trained to see and look after any problems which a child face over a period of time when they are growing. It could be like any illness, any viral, any kind of growth related issues which can come in over a period of time. That is exactly what a pediatrician will do. There are developmental pediatricians are the pediatricians who has a knowledge in terms of what milestones a child should be having in terms of different areas of development. So your different areas of development, let me give you an example. Like as you mentioned, speech and language, it is an area which needs a development which has specific milestones to be followed. If I talk about motor milestones, the way the child starts holding his neck or starts sitting, crawling, walking, this also has a set of milestones, and this also requires certain time frame to be assessing whether the child is developing in a normal way or not. So this is again one area. Now when we talk about play development, so play development, let me give you an example. Like initially by till 2 years of age, child is more of towards solitary play or observational play. Then comes the phase when the child starts getting into parallel play, that the child is not yet engaging with others, but is trying to follow what others are doing and doing the same with his own toy. So this is kind of parallel play which comes. Then around 4 years, 3 to 4 years of age, the child starts getting into something called wherein they start joining others to play with. So this is how the play development takes place. So this is another milestone which not everyone would be aware, but a developmental pediatrician knows that these are the certain stages which should come, and different areas have different stages. And this is exactly where developmental pediatrician would be able to help the parent to confirm the problem which they have come up with, that is this a point of concern or not. Fine. If that is the point of concern, then whichever area you feel that the concern is, then you need to go to the concerned person to get help. Like if it is just a speech and language delay, then a speech and getting to a speech and language therapist would be the best thing to do, because he is the person, he is the professional who is trained ideally to treat these kind of issues. If it is a motor milestone delay only, then it is an autist job, occupational therapist job to guide the parent accordingly. Fine. So this is something which they should do. Now if it is a group of issues which are coming in together, then it is a teamwork which is needed. And then getting a guidance from other team members is also equally important. So it is exactly on what kind of representation the child has. Based on that, we have to meet the professionals. Most of the time when you, like, suppose if there is a child who is coming to me first with concern of speech and language delay, and I see that this child also happen to have some kind of motor issues or sensory, other body sensory issues, which is a point of which an OT can handle well. I would always guide this child to an occupational therapist, because I know that this person, this child can be helped with occupational therapist also. So this is how it usually goes. Fine. So this is what I would answer to this question.
Right. We have another question that's come in related to stammering, and this is from Bhavna Oja, who's writing in from Pune. Bhavna says, "Hello, doctor. My son, who is 6 years old, is stammering while talking. He started stammering only over the past 6 months, but earlier he was speaking well during his school days. Please tell me what to do to improve his speech."
Okay. So, Bhavna, you said the name of the mother.
That's right.
Yeah. Thank you, Bhavna, for your question. You said that your child is 6 year old, and you saying that it is just 6 months that he has started having this problem. So, to this particular, knowing this particular thing, I would ask to you to probe whether there was any incidents or situation which was surrounding this particular incidents when was it a sudden kind of onset of stammering? Because at times when the child has got some kind of shock due to any situation or anything, which whatever they have attended, which maybe remains unknown to you for some reason, since you were not accompanying the child at that particular time, that also can give rise to something like this. And in that particular situation, knowing that particular thing would also, and making the child understand whatever had happened and why that had happened, would help the child to come out of this particular problem. Also, not focusing much in terms of negatively towards this stammering is something which I would suggest. And regular instructions which I give parents to take care of this particular child would be like speak slowly whenever you are talking to your child. Make sure you are trying to understand what was the cause of the sudden eruption of stammering or non-fluency. If that does not, if you don't get to any point as such, or it remains even after 2 to 3 months, if you are continuously doing these kind of exercises with your child, talking slowly, making him indulge into play where he taps and talks, so do these kind of things, you can start working with him. If that does not help, then seeking a professional help would be recommended. So don't waste much time, start working on the as I guided for 3 months. If that does not improve, then a professional help would be advisable.
I hope that helps you, Bhavna. For those of you who have joined us in between, I encourage you to watch the entire video on ParentTune to understand how to tackle your child's speech and hearing issues. I would also like to remind you that you can ask your questions to ParentTune doctors and experts 24/7 on the ParentTune app. Do remember to subscribe to our social handles for updates on our interesting lives and workshops. Dr. Vitika, before we conclude today, if you could tell us what are the top three things that we should do if our child is facing any hearing trouble?
Okay, so the top three things is, first of all, the parent knows that there is a hearing problem. It's just accepting it exactly that takes time. So knowing it, from the stage of knowing and from the stage of accepting, if there is a huge gap, that actually affects your child's development. So I would say, think positive, rule out whether your whatever whatever negative thing which is there in your mind, go ahead, rule out, see whether the test comes negative. And if it is coming negative, whatever has had to happen has happened. Now at least try and work on rectifying it, so that the impact is not much. So that is something which I would say. Because why I'm making this statement, because with my experience with parents, because of, they know by the time the child was 6 months, then the parents knew that the child had hearing problem. But from 6 months till 5 6 years, they just waited in hope that something would happen, something would come up, which or there would be some person who would say that everything is okay. So living in false hopes is something which I would not encourage anyone to do, because you have actually missed a golden period of language development. Language is very important. It's not just hearing which I'm talking about here. Hearing is important for us because language is important for us. This child will not develop language if you delay him on these lines. So if you have any doubt, go ahead, let's get your child screened on hearing. Fine, as it is mandatory, it is mandatory for every child that they have to be screened. So go ahead, get him screened. Go ahead with your preventive measures, like the impedance test which has to be done every year till the age of 5 years. Go ahead with these tests, everything will be okay. Second, if you see that the child has specifically a child has a lot of cold and cough regularly happening, try working on the immunity boosters with your child first of all. Because the moment you work on all those lines, you see that the child improves a lot in these areas too. Third very common situation which is mostly related with hearing loss is adenoids. So enlarged adenoids is one of the area which creates attention deficit, Yes, you heard me right. It creates attention deficit. Attention deficit. Why? Because the child has lack. The oxygen which is reaching the brain of the child is less because they are not able to breathe in properly. So adenoids, enlarged adenoids, is not just a situation. Actually, it is affecting your child's brain. It is creating attention deficit disorder, which is further damaging your child's in terms of, first of all, the language gets delayed there because they are not able to attend to their environment. Also, because of this, a lot of middle ear issues come in, and the hearing problem also comes in. So it becomes an important thing to go ahead and assess these areas also. Fine. So please, next time when you hear that there is something like, enlarged adenoids in your child, which is very common, please go ahead and seek whatever treatment is applicable there, because this is one of the very important root cause behind the delays which happens later on, and also behind the hearing problem. So this is what I would say. Don't ignore. This is my key to, all the parents. Don't ignore. You know it somewhere. You know it.
Right. Thank you so much, Dr. Vitika, for joining us today and all your expert advice related to speech and hearing issues in children. We'll be back with another Parent Tune Live tomorrow. Joining us will be Dr. Rakesh Tiwari, who is a pediatrician, and he will be answering all your questions on how to go about healthy weight gain for your baby. Take good care and see you all tomorrow.
Thank you.
Thank you.